Hi everyone, welcome to the class of Kidscovery, Pediatrics class, Pediatric initiative by me. I am your faculty, Dr. Parv, and we are discussing Kawasaki's disease. Now, Kawasaki disease is something which people teach in cardiovascular system, some people take it in hematological disorders, but I have kept in the subject of orthopedics. Why? Because one of the key manifestations of this Kawasaki's disease is arthritis. Okay, one of the key manifestation of Kawasaki's disease is arthritis. So let's quickly start with the topic of Kawasaki disease. So Kawasaki was a scientist, a Japanese scientist, not scientist actually, he was a Japanese guy, Japanese pediatrician you can say. And Kawasaki, because earlier the cases of Kawasaki were more commonly seen in the Japan, in Chandigarh also. Chandigarh is the capital of Haryana and Punjab state of India. So in Chandigarh also the prevalence of Kawasaki disease is very much. So what is Kawasaki disease? So it's a mucocutaneous lymph node syndrome. It's a mucocutaneous lymph node syndrome. So it is going to involve your mucous membrane, your skin, your lymph nodes. And why I do say this mucocutaneous, because we have seen that it has involved the tongue. So of course there's going to be muco. Then cutaneous, it has got rashes. Lymph node, because it has got a adenopathy also. So let's start our discussion on the topic of Kawasaki with a beautiful mnemonic which is called as crash. C for, it's not crush, it is crash. So C for conjunctivitis. Okay, it's a conjunctivitis. Now please understand that Kawasaki is a systemic disease, and anything which is systemic will go bilaterally in both the eyes. So there will be bilateral conjunctivitis. Now this conjunctivitis is not because of any infection. Since it is not because of any infection, it is a non-exudative. There is no exudate which is going to come out. So it's a non-exudative bilateral conjunctivitis. Is going to have rash also. So in Kawasaki there is going to be a polymorphic rash which is going to go on the trunk. It can involve the palms, it can involve the soles also. The mnemonic is P, Q, R, S, T. So P for polymorphic rash, then R for rash is going to be there, Q for nothing, S for soles, T for trunk. So all these things are important. Next comes adenopathy. So adenopathy means there will be cervical lymphadenopathy, mostly more than 1.5 centimeter. Then there is going to be strawberry type of tongue. So strawberry tongue means the tongue is going to have erythema of the oral cavity, and of course there will be dry cracked lips which will be there. So let me just show you. See this cute little tongue which is protruding out of this small little kid. So this is the strawberry tongue with a dryness which is surrounding the lips. Okay, and then crash burn is the full mnemonic, which is H for hand and foot disease. So hand and foot are going to have edema, erythema, desquamation of the fingers of the toe. Burns means of course there's a lot of fever. Okay, 101.4 degree Fahrenheit is going to be the fever, which is going to last for how much days? Last for 5 days. Okay, now additional mnemonic, one more mnemonic is steam also. One is going to be sterile pyuria. So there will be WBCs which will be released in the urine, but there is no infection. There is thrombocytosis, that means there is platelet count is increased in Kawasaki's disease. E for elevated ESR, elevated CRP, that means systemic inflammation, because conjunctivitis is happening. Okay, so meningitis is going to happen, cheilitis, glossitis is happening. So this multiple inflammation which is going to happen. So of course your ESR and CRP are going to be increased. Of course meningitis is going to be there, but aseptic. So there will be pleocytosis which is going to be there, but there is no clue of infection. Myocarditis can occur because sometimes we see that there are coronary artery aneurysms also which are seen. So all these things I have already told you, but the important MCQ which is asked out of this is that only the nail changes are going to be there in the convalescent phase. Only the nail changes are going to be there in the convalescent phase. This is one thing which you have to remember. Okay, and the 3 peaks are with the skin. Okay, 3 peaks are going to be with the skin. Okay, then you have got the complication. What is the major complication? See, the major complication in Kawasaki's disease, okay, K and C are phonetically very similar. So K, K, for coronary artery. So remember, this is going to be coronary artery vasculitis that leads to coronary artery aneurysm, and of course myocardial infarction can happen. That's why all the faculty of pediatrics are very much interested to take the Kawasaki's disease under CVS topic, because the most common problem is the coronary artery aneurysm. Coronary artery aneurysm is the most important complication which is going to occur. Okay, so what is the diagnosis? So fever for more than 5 days plus any 4 or 5 things which are going to come in the crash criteria. Now what is the key diagnostic tool? Of course, coronary artery aneurysm is going to occur, and since the coronary artery aneurysm is occurring, echocardiogram becomes the most common, most important part to check for the coronary artery aneurysms. Okay, coronary artery aneurysms also. So we do a test which is called as dobutamine stress test. What is dobutamine stress test? So we give dobutamine, and the function of dobutamine is to increase the force of contraction of the heart muscle. Okay, so it increases the force of contraction of the heart muscles, and once it increases the force of the contraction of the heart muscles, if the child complaints of any change in the pattern, like the child is having increased pain, if the echocardiography shows any change, okay, if is the ejection fraction going to increase or not, okay, in the dobutamine stress test, this is everything of them is going to be told by echo. And if ejection fraction is not good, that means coronaries, if the patient is having pain, okay, ejection fraction is less, that means coronary arteries must have developed aneurysm also. And if you think that echo is not okay, you can do angiography also to fully assess the coronary artery tree. Laboratory examinations, of course, is going to relate with the inflammation, like elevated levels of ESR, CRP, leukocytes also with left shift. Left shift means that in an attempt to increase the synthesis of WBC, what happens? Bone marrow synthesizes some of the immature WBCs. Okay, in an attempt to synthesize good amount. Okay, sometimes we have seen, okay, there are various coaching institutes, they are having a lot of students, but the quality is not good. Okay, so this is how you can understand that in an attempt to increase the synthesis of WBCs, the quality is not good, the immature WBCs are going to be formed. Then thrombocytosis occurs. Yes, platelet count can be increased. And of course, what is the treatment for Kawasaki? We give intravenous immunoglobulins, and aspirin has to be given. Intravenous immunoglobulins and aspirin is something which is given. IVIG, aspirin. So why? Because IVIG, intravenous immunoglobulins, decreases the risk of coronary artery aneurysms because it has got an anti-inflammatory reaction. Similarly, aspirin also reduces the risk of coronary thrombosis, antiplatelet effect, and also has got anti-inflammatory action also. That's why we give IVIG plus aspirin. And what are the second line therapies which we use? So second line therapies are TNF alpha inhibitors, glucocorticoids. Okay, so these things are also given as an adjunct. Okay, so what are the treatment of Kawasaki? IVIG is given, aspirin is given, and then you have got glucocorticoids which can be given, and of course you can give the your TNF alpha inhibitors. So the mnemonic to remember is actually GATE. Okay, so that's it for the Kawasaki disease, and thank you so much for attending this lecture.